4 vaccine candidates are now in the final stages of testing, and another 7 are about to enter into this stage. Although the competition is fierce, pharmaceutical companies demonstrate a rare show of unity in trying to reassure the public that vaccines rolled out in record time can also be safe and effective. FDA vaccine consultant and Stanford researcher Dr. Carrie Nadeau helped develop both the Johnson & Johnson and Novavax vaccines. She says regardless of the approved option and timing, Americans can trust the process.
So I think what I'm really pleased to know is that the companies, the FDA, they've taken the stance that they're going to be super careful about this. They're not going to let any vaccine get out to the public that could put anyone at risk. So that's fantastic.
Technological advances over the years have helped to speed up vaccine development. Also, scientists have been analyzing COVID-19 vaccine data as it comes in, instead of poring over pages of information after trials are finished, as is typically done. Plus, millions of doses are being manufactured now instead of waiting until after approval. Distribution plans have also been mapped out so vaccines can be administered the moment the FDA gives the go-ahead.
There are a lot of different vaccines, and they come in different shapes and sizes, and they're made slightly different ways to activate the immune system so that you can build up that immune strength to hopefully combat the virus if you ever get infected.
Last month, 9 companies issued a joint statement promising not to seek FDA approval unless a vaccine meets their toughest safety standards.
We've got to be thoughtful. We understand there's an epidemic, but we need to get our science right so that we can make sure that we help the American public and the globe.
The CDC and NIH add that when vaccines receive the green light, their data will be made available to the general public. In the meantime, people should talk to their doctor about any concerns. No vaccine is 100% effective. The FDA says the lowest it will tolerate is 50% efficacy. Masks and social distancing will still likely be advised in the months following the release of one or more vaccines. Lorie Johnson, CBN News.
Well, CBN's medical reporter Lorie Johnson joins us now for more on the topic. And Lorie, let me put you on the hot seat. Do we have a date when a vaccine could be available to the general public?
Well, the Pfizer CEO said probably the 3rd week in November they will be asking the FDA for emergency use authorization. So we're looking at Pfizer possibly crossing the finish line first, but there are a number of others that are also very close to finishing their phase 3 trials. So we're talking about a number that will probably be asking the FDA for emergency use authorization in November, December, January, or February. So we're going to need actually about 700 million doses. There are about 350 million people in the United States, and most of these vaccines require 2 shots, an initial shot and then about a month later a booster shot, although the Johnson & Johnson vaccine only requires 1 shot. So it looks like we'll have a lot of different vaccines, a number of different vaccines from which to choose. The first people who are going to get the vaccines are those frontline healthcare workers and the highest risk people in nursing homes, assisted living, and so forth.
Do you have any idea of how many vaccines will be approved?
Well, it looks like there are about 4, 5, or 6 of them that are in their final stages and are looking very promising. And the government has actually contracted with a number of these vaccine manufacturers to start making hundreds of thousands of doses. And so it looks like there will be at least 4, 5, perhaps maybe even 6.
All right, well, I have to count myself in this. I'm wary about taking the vaccine, and a number of people are joining in that. And so the number who say they'll actually take it keeps diminishing. Will enough people actually get vaccinated to create some kind of broader immunity for the general population?
Well, that's a great question, and you're right. The number of people who say they're going to definitely be vaccinated is diminishing. Healthcare workers are concerned about this because a certain number of people, a certain percentage of people need to have that immunity to protect people who are at greatest risk, for whom the vaccine doesn't work very well. But On the other hand, a lot of healthcare experts are saying that once these first people start taking the vaccine, then the rest of the general public kind of hangs back and sees how they do. And if they do well with it, more people will get on board by spring when it's available to most of the general public.
All right, we've got some viewer questions because this is 700 Club Interactive. So a viewer, AG, is asking, what are the long-term effects of a COVID-19 vaccine? And in the event of an adverse reaction, who will be held accountable?
Well, we don't know the answer to the long-term effects of the COVID-19 vaccine yet. The data hasn't been made available. We don't know, for example, how long it's going to provide immunity, how many months or years. And of course, any negative long-term impacts would probably knock a vaccine candidate out of the running. Regarding who would be liable if there were any problems with the vaccine, if the vaccine was manufactured in a defective manner, then the vaccine manufacturer would be held liable. Although if the vaccine is manufactured in the way that it was approved and there were some negative outcomes, the manufacturer would not be held liable just because of the inherent risk of a vaccine. And this is pretty standard with all malpractice liability. For example, if you're a surgeon and you're negligent, then you would be held liable. But if the patient doesn't do well in a surgery, the surgeon wouldn't be held liable because of the inherent risk of the surgery. And this is something that we see across the board in all of medicine. There are risks associated, even very low risks associated with certain medical procedures, whether it's a surgery or a vaccine. But doctors say you have to weigh that against the risk of not getting vaccinated or not having a surgery. So a lot of people who are nervous about the vaccine are encouraged to talk to their doctor about it.
Well, if there's sort of unknowns here, and one of those big unknowns is we don't know the long-term effect of the virus or the long-term effect of the vaccination. Doesn't that continue counseling social isolation, washing your hands, wearing a mask, essentially staying in a lockdown universe until we can figure this out?
Absolutely, and I'm really glad you brought up the long-term impacts of the actual coronavirus, because we're now starting to see these, and I'm talking about things like inflammation around the heart. Now, this is after people have recovered from the coronavirus. We're seeing long-term mental health impacts like depression that occurs months after people have recovered. Also, possible permanent lung damage and neurological issues, which are particularly concerning, including an increased risk of Parkinson's and Alzheimer's.
Well, you're full of happiness today. I mean, it's just, you take a step back from all of those statements and you go, why would I take even a weakened version of this virus in order to create some kind of immunity if it has that long-term impact? Why would I do that?
Absolutely, and it's a very good point. And healthcare experts are saying even after the vaccine comes out, we're definitely going to need to continue to social distance and wear those masks and wash our hands until a greater number of the population is vaccinated. But healthcare experts say really the vaccine is probably what's going to turn the corner regarding this terrible pandemic.
All right. Well, we've got one last question from a viewer, and this one came in on YouTube. Do we have to take the vaccine? Is it going to be mandatory for school, for work, or even more? Is the government going to mandate this?
Well, that's the two excellent questions. And regarding school and work, possibly. These are decisions that are going to be made on the local level. Individual school districts will decide whether people have to be vaccinated. Children, teachers, and students need to be vaccinated for COVID-19. Same thing for individual workplaces. Hospitals and nursing homes might require their employees to be vaccinated, and other companies. Regarding municipalities, this would be done on a citywide or a statewide basis, it's very hard to imagine municipalities requiring vaccination, but there is precedent for it. Back in 1905, the city of Cambridge, Massachusetts mandated all citizens get a smallpox vaccine, and for those people who refused, they were fined $5, which in today's money would be about $150. So even then, they weren't required to get the vaccine. Their punishment was a small fine.
All right, well, you've given us lots to think about and lots to look forward to, and I know that you'll keep us informed. You can always get the latest from CBN News and from Lorie Johnson by going to our website, cbnnews.com. And Lorie, thanks for being with us.
My pleasure. Thanks for having me.
Hello, I'm Gordon Robertson. Thanks for watching the video. Be sure to like, subscribe, and hit the notification bell for more encouraging videos like this one. Welcome to the 700 Club Interactive family, and God bless you.